Welcome back to Step 1 Network. This is the last in our series talking about bloodborne infections. Today I'll talk about the different testing that is available. So please look back to the previous videos in the series for much more information about the different bloodborne infections. We're specifically talking about hepatitis B, hepatitis C, and HIV. So the testing that we do for all of those is typically a blood test, although there are some other tests available in some places. We take 1 to 2 tubes of blood that are sent off in Ontario to the public health lab to do that testing. The testing is mostly antibody testing, that is looking to see if your body has made antibodies against those different viruses, but I'll give you a few more details on each of those. So in terms of hepatitis B, there are like 6 different tests available. It's kind of complicated, but there are 2 or 3 main tests that are done. So they look for different antibodies that can tell if you fought the infection or if you have been immunized and the immunization has worked, that your immune system has made antibodies against the Hep B virus. And then the other test they do with the initial testing is an antigen, that is the surface of the Hep B virus itself, to see if Hep B is in your system with an acute infection. The follow-up testing that can be done after that, if those are positive for infection, is to do a second blood test that actually looks for the level of that virus in your system. If you are someone who is at high risk and that testing shows that you don't have the infection, but also that you are not immune or protected, then in Ontario you qualify for a free immunization to help protect you against Hep B. For Hep B, it could take anywhere for 2 to 6 months after exposure for that antibody test to be positive. The antigen test, that is the actual surface of the virus itself, can be positive in a much shorter period of time, even 1 or 2 weeks after exposure. But as you recall from the previous videos, with Hep B, your body can often fight it off. With Hep C, there's one initial test, again, which is an antibody test that typically takes 6 to 9 weeks to become positive, but has rarely been found to take up to 9 months to become positive. If that antibody test is positive, then we do a second blood test to actually look for the viral load, that is whether the amount of virus that's in your body, and the genotype, which subtype of that virus is present. With HIV, the initial test, again, is a mixed test. Historically, what was done was just an antibody test, and while up to 97% of people could become positive in 3 months, 3 months post-exposure is a long time to wait. And so in Ontario, the Public Health Lab in the last few years has added on an antigen test for P24, which is actually looking for the surface of the HIV virus itself in your body, because that one can become positive within the first few weeks. Again, if that one is positive, a second blood test will be done to look for the actual level and type of that HIV virus, and also whether it's sensitive or resistant to different antivirus medications. So again, that initial test is typically 1 or 2 tubes of blood, which is only 1 or 2 teaspoons per tube out of the 5 liters in your body, which is sent to the public health lab to look for those different antibodies. And then if any of those are positive, you'll be called back typically for a second test. Of course, you should book back with the nurse or doctor who drew your test to review those results. Either way, review your risk factors and how you can protect yourself. For those of you who live in Sandy Lake, we will be doing a testing campaign the next 2 weeks. If you have ever done anything that is a possible risk factor for Hep B, Hep C, or HIV, please come out to get tested. So that includes having a blood transfusion before 1991, ever using any sort of drug use equipment to inject or snort drugs where you might have possibly shared with another person, having higher risk sex, that is sex where blood is involved or with a person whose status is unknown, tattoos done at home, being in jail or homeless or other places where there's higher risk of exposure to those viruses, needle stick injuries, etc. Please come on out and get tested, because if you know your status, there are treatments available to protect you and those around you. Thanks for watching. Check out our Facebook page for more information. Bye.